MMT, shoulder extension, posterior deltoid. Assist the patient to the prone position. The patient should position the shoulder in internal rotation so that the palm is facing up and maintain the elbow in extension. Stand at the test side close to the arm being tested. Passively extend the patient's shoulder, keeping the shoulder internally rotated and elbow extended. Support the forearm and the elbow with your hand. You are not assessing the infield. You are determining how much range the patient is able to move the shoulder in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to extend the shoulder while keeping it in internal rotation and the elbow extended. Stabilize the patient at the scapula and across the upper back. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include elbow flexion to decrease the lever length and any movement out of the plane of shoulder extension. Any trunk rotation should be corrected. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the scapula and across the upper back with one arm, and the other hand is contoured over the posterior arm just proximal to the elbow. The resistance is applied in a downward direction toward the floor. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in shoulder extension and holds against maximal resistance. Grade 4, good. The patient completes full range of motion in shoulder extension and holds against moderate to strong resistance. Grade 3, fair. The patient completes full range of motion in shoulder extension but does not tolerate any resistance. There is no position change for grade 2, 1, or 0. Grade 2, poor. The patient completes partial range of motion in shoulder extension. For grade 1, stand at the test side close to the patient's arm. Palpate the posterior deltoid by placing your fingers over the inferior lip of the scapula. The patient attempts to extend the shoulder, maintaining the palm upward. Grade 1, trace. Palpable contractile activity of the posterior deltoid with no motion. Grade 0, no palpable contraction.